Children's and Overview and Scrutiny Committee, and we've got some people stuck in traffic, which we understand is quite bad at the moment, but we're going to plough on instead. I've agreed with Mark Joy, the spokes for the Tories. There's nothing contentious, so we're going to plough ahead, if that's okay. So, apologies for absence. I've got Robbie Lammas, and thank you, Kwasi, for subbing. Then we've got Leanna Rogers, Alice Pledger, and our young person as well. And then it goes on to item agenda 2, which is records of the last minute meeting, which I've looked at. Can't see any errors. Well done, Stephanie.
Sorry, Chair. Just Councillor Wainspring is on his way, but he's currently stuck in traffic, so he'll catch up as soon as he gets with us. Thank you.
Lovely. There were so many traffic names to mention, I didn't worry about the names. Thank you. So, record of the last minute, is that agreed? And can I make a signature on there? Thank you. Urgent matters arising. I've got none, except I feel we need to make a heartfelt thank you to Raj, who will be leaving us. He's done an absolute sterling job as the kind of bridging an interim, and I've had some tricky conversations with him where he's helped me a lot, and I know he couldn't have been, there wasn't a better person for the job, and we wish him well and we thank him for all he's done for us in Medway, and obviously we are a place that grows people, and it's sad that people go upwards and onwards, but that's the nature of the beast, isn't it? Yeah, thank you. Any particular interest or whipping matters or peculiar interests? Hello, Alice.
I am a governor at St Mary's in Gillingham.
Thank you, Sharon. Okay. Paula.
Thank you, Jo. Just to declare that I sit on the Rochester Grammar School for Girls Charity and the Sir Joseph Williams Mathematical School Scheme.
Okay, thanks, Paula. George.
Thank you. I just need to declare I'm a member of both the Beyond Schools Trust and the Inspire Partnership Academy Trust. Thank you.
Thank you.
So there's nothing specific in here, but I am a trustee of the Sunlight Centre in Gillingham, which it has lots of commission services through public health.
Thank you.
Yeah, I'm a governor at Balfour Junior School and also a member of the Fortis Trust.
Thanks, Liz. Oh, it's lovely to have such an active committee. Well done for all you do. Okay, so our meeting, as I said at the onset, is about public health, and we're going to hand over to David to start.
Right, yeah, great. Thank you very much. So the presentation is in your papers pack. It's quite a long presentation, so I'm not going to go through every single slide. I'll just give you an overview of the presentation to allow time for questions later. After my presentation, I will hand over to my colleagues Ailish and Scott, who will then give brief presentations of their two papers. So the role of public health, in public health we have three sort of ultimate outcomes, and that is to increase life expectancy of the population, increase healthy life expectancy, and to reduce health inequalities, the unfair differences in these outcomes. And we do this in a variety of ways, through health improvement, for example, smoking cessation or improve our healthy weight work, by helping people to stay healthy, by working in partnership with others, including tackling the wider determinants of health or the building blocks of health, such as housing, employment, and education. One of the vehicles that we use to do this, or to structure all of this, is our joint local health and wellbeing strategy, which is the strategy of the Health and Wellbeing Board, and it helps us to identify the key issues that we need to be focusing on in Medway. It's a joint strategy of Medway Council, the NHS, the voluntary sector, and the people of Medway. There are several key components in the strategy, and we have 4 priority themes, and you can see that within those 4 themes there are several elements that are directly related to the health and well-being of children. And then there are other elements that are more sort of generally related to the population, of course, also relevant to children and young people in Medway. As well as delivering our own services, we commission a number of key services. So, for example, we have services for drugs and alcohol through the Forward Trust, health visiting through MCH, sexual health services through KCHFT, and domestic abuse through Oasis. And we have a range of services that we deliver ourselves. We're very proud of the huge range that we have available in Medway, delivered by the Medway Public Health team under our brand of A Better Medway. All of these are available through the A Better Medway page on the council website. And this includes various things such as work to improve healthy weight, increase physical activity, improve healthy nutrition, improve cooking, and we have our bump club for healthy pregnancy, and we have smoking cessation, early years work, etc. So there's a range of different services that we provide, and we're always looking to innovate and come up with new and better ways of delivering services for the people of Medway. I'm not going to talk about Start for Life and Family Hubs now. Ailish will be covering that in a moment. Let's skip over these. As I said earlier, we don't just do everything ourselves. We work in partnership with other people within other organisations and people within Medway. Improving health and well-being, improving life expectancy and healthy life expectancy is a huge task. It's not something that a single team can do on its own. It's something that we all need to work on together. And through our strategic work and our networking and our partnerships, we aim to use the resources and the levers of other people and other organisations to improve health and well-being. Oops, didn't realise it was coming like this. Another approach that we use is our Better Medway Champions programme. We've been running this for a number of years now, and it's an important way for us to build capacity across the Medway. Sometimes people don't want to take, or sometimes people take more notice of what their friends and their colleagues tell them rather than what professionals say. And the Better Medway Champions training program is a way for us to create the capacity in the general public, in the sorts of people who live in the communities in Medway, who can then have conversations with their friends, with their family, with their colleagues about ways that they can improve their health and well-being. The final part of the presentation is just a few of the outputs and outcomes that we produce in the public health team or that we keep an eye on in the public health team. So, for example, this slide here shows data on A&E attendances at Medway Hospital. So this is not something that we work on directly ourselves, but it's something that we play an important role in understanding and informing the health system across Medway. And you can see here, for example, the attendance rate for children under the age of 5 at Medway Hospital at A&E has doubled over the last 10 years. And this, of course, adds to the pressures that the hospital are facing. I think I won't go through all of the data here, but I'm happy to answer any questions on it. I just want to finish with this slide here, which is a nice snapshot of some of the key achievements that we had for the year 23-24, showing the number of people that we've have received health checks, for example, or who have quit smoking as a result of the services that we deliver. So I'll stop there and hand over to Ailish to talk about family hubs and the Start for Life program.
Thanks, David. I am going to keep this very brief because you have got the paper in the pack. Just to say that we came last year to talk about the launch of the Family Hubs and Start for Life program, and many of these things we hadn't actually got in place yet. So I'm really pleased to be able to come back a year later and be able to demonstrate that so many of those programs have been up and running, and we're even demonstrating some outcomes against some of them as well. The Family Hubs app was launched in April and has been really well received by families across Medway, with over 5,000 downloads to date. There'll still always be work that we can do on that app, but at the moment it gives a really comprehensive signposting offer to our families across Medway. We've been able to use the investment to upgrade our hubs themselves as well, so there's physical premises to be more welcoming and more accessible, including having sensory spaces within them for use by staff and our families as well. We've used the investment to have some dedicated courses, not just around universal parenting support, but some specific directed support, for example, around fathers, around a range of parenting issues, as well as around support for fathers in terms of that mental health space as well. So happy to take questions, but hopefully members can see the progress that we've made in a relatively short time with the investment that we've had for that Family Hub Start for Life.
And just to, I think we're going to take the child obesity plan at the same time. So just in terms of an update on the child obesity plan, I'd like to think we've had a strategic approach to tackling obesity for a number of years now. We developed our whole system obesity program a number of years ago, but we hadn't actually formally put it into a single plan and stated our aspirations for the next 5 years. And that's what the 5-year plan is aiming to do. Child obesity, adult obesity is very much like David says, in more of a wider health and wellbeing context. There's not one single thing you'll do. There's not one single person that will aim to achieve it. So we are always looking for more partners to engage in our Healthy Weight Network activities. We had a very successful Medway Food Partnership event on Saturday, bringing together food retailers, people working food poverty, and a number of other kind of sectors. And Councillor Murray kindly closed that session for us. We've had various initiatives and campaigns over recent years, including our Medway Can initiative, and what you'll see within our kind of formal detailed list of interventions, we do have our cookery programs, weight management programs, we do have walking to school programs. So there's a large amount of interventions delivered by the public health team, but obviously we're always encourage our council partners and our wider system partners to support any initiatives that gets people moving, that focuses on healthy, sustainable food, focus on the mental aspects of obesity as well, because that's a really key indication, a key factor. So yeah, what we've put together is our 5-year plan priorities. These are very much just copied and pasted from the One Medway Council plan rather than come up with brand new targets. Obviously, the targets themselves are within the 5 years, but the purpose of the One Medway Council plan obviously was to reflect, and if we're overachieving them already, can we set ourselves a stretch target? And then importantly, I think most importantly, in terms of the action, what we're doing about it, because even if it does come down a bit this year when we have the data out, or if it goes up a little bit, the scale is still huge. We are still talking, more than a third of children being overweight or obese before they leave primary school. So our priorities and our targets, the final table in the paper there is aiming to show what we're aiming to do, by how many, and as measured by what. And hopefully you'll see there's a nice diverse range of partners and system council departments to kind of help with that, whether that's getting more children walking to school or active travelling to school, increasing our breastfeeding rates, or more people accessing green spaces. All of those contributions will add up to a big difference if they're done at scale.
Thank you, David, Eilish and Scott. That's very comprehensive, and I've already said I was impressed with the handouts, especially when you see the statistics, but when you colour code them, you can see at a glance progress that has been made. So let's open it up to questions, please. Smitha, Paula, Mark and George. Thank you. And Keith. Thanks. Smitha.
Thanks, Jo. I found this really illuminating, and I just want to congratulate all your teams for the amount of work that you're all doing. It's a bit like you've got your fingers in every pie that's to do with the people of Medway's lives, so that's pretty impressive. And I also think there's real understanding of all the factors behind the outcomes we see. So, for example, child obesity, and this shows that there's real thought and investment into all the little things. That jigsaw puzzle image particularly was, I thought, very, very telling. I do have a couple of questions, though. I'll start with you, David. On page 34, A&E attendances, persons 0 to 4 years, by ward. I'm just not sure I completely understood the implications. So, for example, my ward Fort Pitt is in red. What does that actually mean? Like, how should I interpret that? Was my first question. Sorry. That's the one, yeah.
So this is showing A&E attendances and children under the age of 5, showing the rates of attendance. So the wards that are in red have a rate of attendance that is statistically significantly higher than the England average.
Okay.
The wards that are in green are statistically significantly lower. And if we look at the wards that are in red, quite a lot of them are wards that are actually not very far from the hospital.
That makes sense.
And they tend to largely be sort of several of our sort of more deprived wards as well. We think this is probably due to difficulties in getting GP appointments, so people are effectively using the hospital like a large GP practice. There's been quite a bit of work that the council's already done to look into access to GP appointments over the last couple of years.
Okay. I thought as much that it might be to do with the GP appointment situation, because I've been in that situation myself. I take my child to A&E. So it'll be good to see the impact of some of the work that's been going in to address that GP appointment crisis situation, and to see it come out here. Thank you so much for that. Page 39, about emergency admissions for asthma under 19 years. What does this mean? Does it mean that care is not available in a timely or accessible way to people who present with asthmatic symptoms? Is that, and what's the connection with deprivation quintiles there?
So yes, so there are a range of factors involved in this. The Health and Care Partnership in Medway and Swale has been doing quite a bit of work looking at this and looking at diabetes as well. And there's a number of programs that they put in place to try to reduce this. And I believe they've already started having some quite good success. If you look on this plot here, on this page here, you can see on the right-hand side the distribution by deprivation. And you can see that there are significantly higher rates from the lower end of the deprivation range, so more deprived areas. So they've been using this information to focus their work to reduce the emergency admissions and to improve the care for children with asthma.
Okay, so in other words, people from more deprived communities are actually not getting the best outcomes in terms of healthcare. Okay.
Smitha, can Eilish come in as well? Is that okay?
Yes.
Thanks, Eilish.
Thank you. Just to add some more context to the work that has been happening both across the Health and Care Partnership and also within the public health team, is what has been identified is that quite often the management of the asthma plan is not good enough. And that's both a combination of the understanding of the parents and how the inhalers and so on are used, as well as the GP reviews that are happening and how meaningful those GP reviews are. So the Health and Care Partnership have actually got a dedicated asthma nurse now who is working, this is across Medway and Swale, but we're working with those GP practices that have been identified with the highest number of children attending A&E to ensure that the asthma plans are appropriate, that children and families know how to use their medication properly. They're also doing a lot of work across schools across Medway and Swale, so we've currently got 34 schools signed up to become asthma-friendly schools, and that's about the training that's put in place for staff within the schools. It's about the management of the asthma care plans within schools as well, and how we engage with the school nurses within those schools. And the asthma nurse is also delivering parenting workshops across Medway and Swale as well. Again, just it's all about the management of asthma and understanding your asthma plan, peak flows, when it needs escalating, and what to do if you are having an asthma attack. So that work's been happening for about 18 months now, and is starting to be fairly well embedded now, but it's fairly comprehensive in terms of the different angles that it's taking to try and improve these outcomes.
Thank you. I look forward to seeing some of those improvements from that work sort of coming in front of this committee. And in terms of the family hubs, I think you received the funding for the program a year late, right, for a 3-year program. So does that mean we've lost out on a whole year's worth of delivery? When you say you've condensed the delivery into 2 years, have we lost out?
We weren't unique in that situation. That was the challenge across the whole country. So the announcement for the Family Hub Start for Life was in August, but the final sign-off of the investment and the approval of the funding plans wasn't until February. So, and as I say, we weren't unique in that. So yes, it has been challenging, I'm not going to lie. We've had 3 years of investment that we've had to ensure was invested realistically within a 2-year period. It put a lot of pressure on the team over the last year to ensure that things were, because it takes a while to commission and recruit to posts, as you can imagine, so that was challenging. But we've done it, and we've ensured that we've got a fairly comprehensive offer and program in place against the 6 areas of the Family Hub's funding, and we now wait for bated breath to find out whether that investment will be continued beyond March 2025 to be able to sustain that program over the longer term.
But there's no way of making that funding stretch across a longer period to
not within the terms of the grant, but Mariah.
So we are bound by the terms of the grant and what we call the Memorandum of Understanding. So sometimes when we put in our grant submissions, we may know that actually we're going to have a delayed period at the beginning, and so we backload the project, and sometimes we front load it. But we always try as an organisation not to send any grant funding back, and we always try to use it fairly expenditure. However, we are bound by the terms and conditions of that grant.
Okay, thank you. I understand. Thank you.
Thank you, Smitha. Paula.
Thank you, Jo. So I've just got a couple of questions. Initially on page 31, the slide about a better Medway champion. So I'm just curious how many have been through the programme so far, and in what way are you measuring the impact of this programme? The next question is, it goes back to the asthma. So I'm curious to know, working in education, how many school nurses there actually are across Medway that are equipped to be able to deliver the programmes that you talked about. And also, to what extent is some of the emergency, asthma emergencies that we're seeing at the hospital driven in part by the limited number of sufficiently trained medical staff in GPs, surgeries across the unitary authority? And then in terms of the obesity strategy, could you tell me more about how you're partnering with the MATs and local authority maintained schools to tackle healthy eating in the school itself, in schools themselves? Thank you.
So I'll start, David, if that's all right, and then hand over to Scott. So in terms of the Better Medway champions, we have over 500 trained now. In terms of the evaluation of that, we were very clear right from the start that this program was about having those community champions across Medway who were confident to be able to have conversations with individuals about health. We didn't want to make that an onerous evaluation for individuals. We didn't want them to have to complete paperwork and return evidence of the number of conversations that they'd had, etc. So actually, unusually for public health, this was not a service that we decided was going to have an evaluation. It is about the ethos and the concept of empowering individuals across the community to be able to have conversations and understand how to signpost people appropriately if that was needed. But yes, over 500 Better Medway champions exist across all of Medway, and our councillors are all very welcome to attend the training and become a Better Medway champions themselves. That's an open invitation, and we're happy to put on bespoke training around that as well. In terms of the asthma, so just to be clear, there's a dedicated asthma nurse that is working alongside the Health and Care Partnership. The school nurses will support children with asthma within the schools as part of their core function. That's not over and above, that's not this additional nurse that I was talking about. The school nursing team is made up of the actual qualified school nurses themselves is around 6 school nurses that we have in Medway. But every school has got a named school nurse, so obviously they cover more than one school, and every school should be able to contact their dedicated school nurse. The school nurses at the beginning of the year and then throughout the year reach out to the SENCOs within the schools to be able to speak about individual children and provide consultation around that, and can also pick up children with additional health needs through that service as well. In terms of the limited training for GPs, so as I said earlier, absolutely what the review and insights into the number of children attending A&E for asthma has identified is that not all of them have got a well-crafted asthma plan, which is understood by themselves and their families, and that the annual reviews that are carried out within the GP primary care are not always robust enough. This is variable, of course it is. There are some GP practices that have got very active nurse prescribers, lead nurses around asthma, etc., and others won't have that within the service. So it is variable, and the work that the asthma nurse is doing at the moment is around upskilling those GP practices, particularly those for whom we're seeing the highest number of attendances, prioritising those first to ensure that they are more competent in being able to carry out the annual reviews and have adequate asthma plans in place.
In terms of the question about school food, about 4 years ago at one of our Healthy Weight Network events, when we asked what was missing from our plan, I think 70% of people said school food, school food, school food, school food. It's such an important, excuse the pun, ingredient in terms of our mix of interventions. So we identified a funding pot, and we've commissioned Food for Life, a really good national organisation who already had a well-orchestrated accreditation programme, so schools can work towards a award that shows they have a whole school approach around cooking, growing, eating. It included things such as teacher training, it included how to develop your own growing projects, it included standards for the menu choices they have. So we commissioned that. We are now 2 and a little bit years into the programme. We have 41 schools signed up across Medway, and between them already they've ticked off 367 awards criteria, so of the kind of checklists they work through. And we have some exemplar schools, and actually it's Oasis, Social Education in these settings was trailblazing really early doors and done amazing stuff. So when we lifted the lid and went into schools, there's already some schools doing some great stuff, and the purpose of the programme is to get everyone to keep pushing the boundaries and do a little bit more. We'd love to have more schools. Noticed many declarations of interest, being people interested in working as governors and other roles within schools. If your school is not part of the Food for Life programme, please do encourage them. It's completely free. It's fantastic, I promise you. And they'll get a certificate, and we can take ward councillors out to award that certificate to the schools. It's just a really good bit of PR for the school and for the parents as we go through. We've got one more year left to run on the programme, and we'll review it halfway through the year to see what the legacy of that project will be. We also have a Healthy Early Years award setting. That's an in-house programme we run for nurseries and preschools, getting off to the really early start. And again, amazing uptake. 67% of our schools have engaged in that and are working towards platinum. We had some videos at the Food Partnership event actually showing some truly kind of heartwarming stories of how they're doing that. So again, if you're involved in nursery and preschool, completely free support available for schools.
Just have one follow-up question about it. So the Food for Life programme, I think, is fantastic. My concern is that we're not having those difficult conversations with schools about how they commission the food that they actually provide in schools. So I'm talking about food for at breakfast time, break time, lunchtime. They still are particularly sugar-laden sources of food that are being provided in schools. And I want to know what sort of difficult conversations we're having with the MATs and the local authority schools about changing that.
10 years ago, it was there was a lot more people that were buying into the block contract, so I think the council had a lot more obvious autonomy and responsibility and ability to influence that, people buying into it. So I think Chartwell's had, when I first started, had 60% of the schools, so that was a much easier conversation to have because you can have it once. Whether the outcome was any impactful is obviously a different story, but with academisation and schools being a lot more autonomous, the local authority has a lot less opportunity to tell schools what to do about things. So we try, again, because we haven't got the influence to, the challenging conversation is different. So what do we want? We want better food standards. So the government food buying standards are here. We'd like them to be here because, they are okay, but they're certainly not what Food for Life have is food served here, accreditation. So again, if a school wants to progress through those 41 schools, we have some really amazing caterers, and it's really pleasantly surprising, and it's not so obvious that, that school must well be, that there is some amazing caterers that do happen across. So I was chatting to a school the other day and encouraged them, it's your buying power is really, really important. It's your contract's up for renewal this year. They switch contracts and they're really, really happy with that. So ours is very much more of a supportive role because of the nature of the sort of autonomy schools get, but we are definitely having those conversations and encouraging it. Obviously, price does impact it, in terms of standards around things. So I do feel sorry for caterers in terms of what they can and can't afford to do within schools. So that's a real sort of challenge, which is bigger than obviously what we can then dictate.
Thank you. Mark, you're next.
Thank you, Chair. Thank you, all three of you, for quite a detailed report. Just wanted to come back on the last question. I didn't declare that I was a governor at a school because it's not mentioned in any of the reports. But one of the things you said about the school meals, I do know at the school, my son's just left, and even with packed lunches, there were strict guidelines to what they could eat, what they could bring in, and if you took your packed lunch in and it had any of that stuff, they took it away and they had the parents in to talk to them about it. So the Maritime Academy of Trust are doing some of the stuff, and there's always healthy eating choices. But one thing I've learned as a parent is that it's not that easy to get your children to eat the healthy stuff. It's a continuous battle. Just had a question for each of you, because I've been quite nice. The first one was to David, the excess weight in 10 to 11-year-olds. I've seen it's gone down from the high over the pandemic period on page 35. The bottom line, it just worries me a little bit because we're celebrating moving from 4th to 6th, but from the figures that you used, the numbers actually went up. So I'd like us to move upwards, but with the number going downwards. And I just wondered when we're likely to start seeing that, because yeah, it's great we've moved up against our peers, but if you look at every single number from they're probably the best data in the last 6 years. Every single one of them, their actual number has actually gone up on that. So on that one. Then the next one was to Ailish. On page 47, you mentioned Dad's Space starting in October 24. Just wondered, is that going ahead? Have we got a date for that? Because I think that would really, really be good, because a lot of dads do struggle, and they're not always there. I can vouch for that, because there's normally other things that seem to take priority and maybe shouldn't, and they do need to be included, because having two parents, whether that's a mum and a dad, two mums, two dads, helps the development of a child. And the final one was to you, Scott. Walking to School programme. I think it's really, really great idea. And if you go back to when a lot of us were at school, we all normally went to our closest primary school, which would encourage. But seeing more and more with developments all over, that not all children are getting to their nearest primary school, which is putting more and more pressure on parents to drive them to there, which adds its own health risks through pollution and also the dangers of having vehicles around children. I just wondered if there's any other way we can potentially making sure, I know we've got the local plan coming up, just making sure that we're getting these schools in the right places so we can encourage more. I know it doesn't always work. I lived in Halling and I used to walk my daughter to school, who's now 18, and the amount of roads that I was walking to a school, I passed with people coming out of their road, driving their little kid to school, and as I'm walking back, they'd drive back home, park on their drive and go in. So I know it's sometimes a losing battle when it comes to parents, but I'm just wondering if there's anything else that could be done. I know the schools push it because I've seen it, but the uptake doesn't seem to be the greatest. I'm just wondering if anything else we can do to try and encourage that a little bit more.
On your first point, I think, because you've asked a question about that data, haven't you? We're celebrating the success, but you're saying it's gone from 36 to 37, so actually has a real-time increase, just not a relative increase. Is that what you're saying?
No, it's just we've moved, so on the thing you're saying, we've moved from 6th against our peers up to 4th.
Yep.
But the data's actually worse.
Because it's gone from 36.1 to 37.3, is what you're saying?
So that's percentage of children that are obese, 10 to 11, so that's an increase.
I think we've got an error on that slide, actually, because the actual number has gone down from last year. So
I said it's gone from the higher bits. You can see it's coming down. Your slide on page 60 looks a lot better. Yeah. It's just showing the data. Yet we had the peak in the pandemic, and we're getting it down. I'm just a bit concerned is on that slide, we're saying, look, we've improved against our peers, but when you actually look at the data, we might have improved against our peers, but we're celebrating something's getting worse, although we're not getting as worse as some of our peers.
David, you want to come in on that one?
Yeah, so just on the data, just to be clear, so that comparison on the right-hand side, that's called a ladder plot, it's not a comparison with last year to this year, or it's from the baseline that we set in 2018-19. But I think the important thing here is that the drivers that influence excess weight are big societal drivers, and there's only so much that we can influence locally. So we do our bit, we contribute to it, but there's a much broader set of factors that are also influencing what children eat, how physically active they are, etc. So there's a whole range of factors that come into play here. So what we aim to do with this plot is to show the data, but we recognise there's still a long way to go and there's still plenty of work to do.
Yeah, thank you.
Thank you, Councillor. So in terms of Dad's Space, I can absolutely confirm that's going ahead. The first course is kicking off on the 12th of October in Halling. The exact venue to be determined because they're co-designing that with the dads themselves about what space they would feel most comfortable in and where to actually hold those sessions. It was really important to the team that this whole programme didn't just focus on mums, and Nikki Lloyd's in the audience here as well from the family hubs, and they felt very strongly about that as well. So of course there's a very strong maternal program through this, but we absolutely wanted to ensure that there was focus for fathers as well. So we've got dad space, but we're also working with the Father Institute around that sort of more universal parenting course program for dads specifically, and that will cover everything from infant feeding to becoming a dad, what does that mean, reading as a dad, all those important attachment parental milestones that we'll deliver to fathers, again, in a space that's comfortable to them. So, yeah, I'm really pleased that we have got that offer within the programme that is looking at all parents.
Totally agree in terms of walking to school and active mobility to school. The challenges are there in terms of practical thing, in terms of, you know, is it possible with the people commuting into work and dropping the kids off en route? We absolutely do need, you know, as an authority, need to make it as simple as possible. Totally agree. There is a really, positively, there are the active travel group, chaired by Councillor Curry, but he certainly goes along and supports that programme. So our active travel team, our integrated transport team, James Sutton, I'm just looking at an email, we attend that meeting as well, just to see how we can link up all these various kind of active travel initiatives. They produced a really handy newsletter this month, September, just gone, talking about the National Walk to School Week winners. The International Walk to School Month promotion they're doing, really keep promoting the walking buses, getting cycling in schools project, the school active travel guides, and the, let's get my title correct, the school streets phase moves into phase 2. So these are all, not all those things in isolation will have a bit of an impact in terms of movement to school actively wise. I would like kind of, you know, as many member support so I can kind of keep challenge that active travel team, say, right, we want to keep stretching that. Say, right, we want to get 10% more kids moving to school in an active way, 15%. So if we can kind of set that target for our peers in other bits of the organisation, we can kind of then contribute and say, okay, what are we going to do about those other practical things that you say around, you know, dropping kids off and being close and making it realistic. So yeah, there is an active travel group. And yeah, we keep nudging them to say, what more can we do?
Scott, you'll definitely get support from this side, as well as I know Joanne and her team as well on that one, so you'll get that from all of us. Always there to support anything that could help keep our children healthier.
Thank you.
Okay, thank you. George.
Thank you, Joe. And thank you, David, actually, for your report, and I know for everything that you're doing as the Interim Director of Public Health. Much appreciated. I know stepping up in difficult circumstances, so thank you. A couple of questions from me. Firstly, I'm just interested in particularly the deprivation indicators and the health outcomes, because we know of the challenges that we've got across the conurbation in the difference, particularly in the key indicator of life expectancy between a number of our wards and some of the other wards within the borough. Just particularly interested from your perspective around what we're doing at a children and young people level, because we know all the indicators show that this begins, and particularly when you look at most indicators now on deprivation, actually the challenges around this start when children and young people are really from their early years all the way through. And I'm just particularly interested in what we're doing to tackle some of those specific wards where we've got very high levels of deprivation, and how that's sort of feeding in to health outcomes. So that's my first question. Secondly, I just wanted to come on. I was at actually earlier this week, I was pleased to talk at a round table, particularly about a new report that Bernardo's and the Co-op have produced about food poverty. I'm happy to share it with you after the meeting. It's a really, really useful report, actually, and a very good piece of work. A couple of things out of that for me, and actually it's sort of tied into the report. So I'm just interested in terms of the local food partnership, what we're doing to ensure that children and young people really are at the heart of that, and able to get their views across. And then around our rural communities and the challenges that those young people have, particularly with obesity, but also in terms of accessing food and being able to access, choice and options. I think particularly some of the challenges that we're facing children and young people within, I'm thinking some of our rural communities on the Hoo Peninsula might be facing actually different to that, accessing food in some of our town centres because of the choice. So I'd be interested in your thoughts on that. And then finally, just about the HAF programme, obviously currently due to expire in March 2025. I'm just interested in your perspective. Obviously, the Medway Go programme has been very successful, has been making good progress. Just interested to know sort of what your thoughts might be around any potential implications of the withdrawal of that programme. Obviously, it's unclear at the moment until the budget whether or not that will be sort of coming forward from central government or not. So just interested in terms of your views on that, and if there's anything we can potentially deliver on a local level to potentially mitigate some of that, and if officers have done any work on that so far. Thank you.
Okay, great. Thanks very much. Some of these I'll pass over to Scott in a moment. So your first question was around how we're tackling issues, poor outcomes in more deprived areas. So a fundamental principle of how we work in public health is applying a thing called proportionate universalism. A terrible phrase, it doesn't mean very much to people, but what it means is that we put more effort into areas where there's the greatest need. So with almost everything that we do in public health, we try to break things down by different groups to see where we have the greatest need, and then we develop our programs to try and focus on those areas of greatest need. So it will depend on the program, it will depend on the particular outcome we're looking at, but we would design our programs to take that into account, to try and put that extra effort into areas that have the poorest outcomes. For all of the questions relating to food, the food partnership, rural access, and the HAF program, if I can go over to Scott, as he's leading all of those.
The Medway, it's a great time question, actually. So one of the things we talked about at the food partnership session on Saturday was we've now pulled together a draft Medway food strategy. So you may have seen the quick headline up saying that Medway has achieved its Bronze Award for Sustainable Food Place. That's Medway as a place, not necessarily just Medway Council. But clearly we're trying to drive that as an anchor institution to say, how can we get more schools, businesses, employers, hospitals to kind of also adopt a whole food programme. So we're doing that through the Medway food strategy. We're bringing that to Scrutiny, but I can't remember which Scrutiny it's going to, because food is so integral to children, young people, adults, business support. It cuts across all four. Do you remember? I think it's coming to health, but anybody's welcome to see the food strategy. We've written the draft, and the four key components of the food strategy: tackling healthy eating, improving healthy eating, food growing, food buying, healthy eating, food poverty, oral health, and food waste. They're the four kind of key priorities. And actually, we've done a lot of recent engagement with residents, and guess what of those four things are most important to our residents? Food poverty, the food prices. So we have done lots of listening. The University of Kent done a really University of Greenwich, done a really helpful piece of insight work for us with workshops, speaking to residents, and University College London, because of our partnership with them now, they're actually starting to do some engagement work with parents in two particular wards over the next sort of couple of weeks. We don't expect that kind of insight work to come back to say anything we don't already know around the concerns around, and it's not even just the cost of food, it's sometimes the practicalities of the cost of going to the shops to buy the food and all the kind of practical things. So we know there's a real challenge there, and great to see lots of food charities engage in the food event on Saturday. In reality, we've got a lot more uptake for those food charities than we had, pre-COVID, so it would be nice to not have such a high demand, but we can't just, wave the magic wand and do that. But that's a really core component. So I'd be really interested in all members' views around what's in the food strategy, how can we tighten it, how can we make sure we push that further forward. So yeah, please do get involved and let us know what you think about that. I'm concerned about Medway Go Holiday Activity Food Programme. I'm sure Marcus Rashford and other kind of champions are as well, because holiday hunger obviously is a hugely topical issue. So we are waiting with bated breath to say, if you take this programme away, I can't see how any local authority can afford to pay for that. It's £1.1 million for us. So we need to have that if we're going to carry on supporting the 2,700 kids we've just done in the summer to have a healthy, active daytime. We've got Christmas week being planned for now. Any promotions for that would be really helpful. But yeah, we are really hopeful that budget will be really clear about that.
Thank you. Next is Keith.
Thank you, Chair. I was interested, as an aside, about the cycling. Do we not have the cycling proficiency courses anymore? Is that not run?
It's Bikeability now.
Oh, right.
So Bikeability is a programme run in some schools, yeah.
Okay. That wasn't my question, by the way. I was listening, I've read the report, and David mentioned about health, general health activities and, God, I'm just trying to think now. Anyway, anyone with a learning disability over the age of 14 is allowed to have a health check, an annual health check. And there seems to be an issue around that in that some doctors are offering it, some aren't. Some are doing it a different way. It's a quick rush through and it's a tick box exercise, whereas others are more thorough. I just wondered whether, as part of the strategy, whether there was any plans to sort of universalise it across Medway so that all the doctors operate on the same system to do those annual health checks. We also know that the message isn't getting out to some of the parents as well. So some of the parents aren't aware that their youngsters with learning disabilities are entitled to an annual health check from the age of 14.
James.
Yeah, thanks for the question. I can pick that up because one of my commissioning managers leads on the learning disabilities and autism health checks across Kent and Medway. So this year's figures were really positive for Kent and Medway. We exceeded the national targets across Kent and Medway. We do monitor GP practice by GP practice as to take up, and as you would expect, some are higher than others, but actually getting over the 75% target was a really good achievement across Kent and Medway. We know historically, I think if you go back 3 or 4 years, the numbers were very, very low around percentages of take-up around those health checks. So a lot of work has been done with primary care, with parents, with carers and people with kind of lived experience to try and get them to take up that. One of the next bits of work we need to do is the sort of next step. So there's one thing about having that health check and getting there and undertaking it. The next bit is around making sure that any referrals and pathways that lead from that are followed up and are taken up, because that's the real outcome-based stuff. So your point is absolutely valid that some practices are better than others, but we do monitor that data and we will hold those GP practices to account if their numbers and take-up according to their population are below average. But this year is a much more positive picture than it has been the last few.
Keith.
I was just wondering if it's possible to have some sight of that data that you collect at all. Is it, unless it's unless it's not for public?
I could take that away. I don't know whether we can share practice by practice or not. We'd probably need to speak to our colleagues in the ICB about whether that data is kind of open and available generally. But yeah, if you can let me take that away as action, if we're able to share it,
I don't think we want to know the actual GP surgeries, but it would be nice to know the differences, perhaps in some of our more deprived areas, for example, as opposed to some of the more affluent areas in Medway.
Yeah, absolutely. Thank you.
Thank you.
Thank you. Sharon.
Thank you for the report. It's really good. I love public health. It's one of my passions. But two things. First, obviously I'm going to come to drinking during pregnancy. Leanne's nodding her head. It's still not on there anywhere, even though we've got the Stop Smoking support during pregnancy and the Bump Club. I mean, I really think that it needs to be on there somewhere. And then secondly, I know that I've spoke to Scott before about oral health in children. What are we doing going into the schools? I know we have the tooth fairy, but I'm just thinking that's at that age group. Are we doing anything with? We know that children aren't getting access to dentists. Are we doing anything at a later age to help them, and maybe at the family hubs with some oral health strategies there as well?
Thank you.
Thank you. I can pick up around the drinking in pregnancy. So we've done quite a significant amount of work on that over the last 18 months. I think, Councillor, you've been kept in the loop in terms of some of that work. We've got a fairly comprehensive training programme being delivered by Red Balloon, which is open to social care staff, but actually also Medway Parent Carers Forum, other frontline professionals have attended that training. And I think as well, as part of the Family Hub Start for Life programme, I did mention that there's a universal parenting programme. The way I describe that is it's sort of NCT, but for free. So it is a really comprehensive antenatal programme that is being delivered universally, but taking into consideration Councillor Perfect's points, that we are targeting that in the areas of most need. And that will include the risks of drinking during pregnancy and risks around FASD. Public Health also deliver a healthy pregnancy programme themselves, and whilst the focus of that is around healthy weight and smoking, it is looking comprehensively at healthy pregnancy, including drinking as well. So there is a number of irons in the fire in terms of healthy pregnancy, as well as the work that midwives themselves do as part of those conversations. And we continue as part of the fetal alcohol syndrome programme to try and ensure that midwives are recording around alcohol consumption during pregnancy as well, because as we all know, that helps with diagnosis later on if it does become an issue. But of course, it's self-reported, so it will always be challenging to get a really true reflection.
In terms of oral health, we do have a oral health strategy, and we have an oral health group that's one of the subgroups of the Medway Food Partnership. Anybody's welcome to come along and participate in the oral health subgroup as well. That oral health strategy and action plan is, for those who don't know, is very much focused on people with the highest risk of tooth decay. So it does spend to our very early years, getting into good habits, and also our older people, particularly working in care homes and residential care. The focus, so the three main things you'll do to reduce tooth decay and improve your health: brush teeth regularly, twice a day, improve your diet in terms of taking less sugar in through your mouth, and regularly visit a dentist. So they're the kind of three things. The scrutiny sessions we've had recently, and for the adult health ones, obviously dental access is a real kind of challenge. There's not too much we can do from an influence and from a public health perspective in direct control. In terms of the thing around healthy eating, obviously I mentioned the Food for Life project and our healthy eating programs. By default, we're tackling it that way without kind of being so obvious. But we do run various kind of campaigns to kind of regularly remind people to brush teeth. I would like to see if we had some more resource and how we could stretch that further. I think there's some amazing work that happens, particularly in nurseries and preschools. One of the videos we saw on Saturday, the Food Partnership, was this brilliant game as part of the Healthy Early Years Award, because oral health is an implicit part of that criteria. How these kids are, showing it, and what the nursery and preschool staff are doing around why that's important, and giving them a toothbrush to take home. So I think there's some really nice work happens in early years. I kind of agree we could do a lot more in schools. There is some fantastic stuff in PSHE sessions, but we don't always know, again, going back to my point around academisation, how much of that's definitely delivered, how well it's received, because there's so many kind of classrooms and actively. So it is part of our kind of PSH rhetoric and part of our Healthy Schools programme on a number of ways, but the scale is challenging to know. With more resource on oral health, we could definitely do a lot more campaigns. We could do fluoridation campaigns as well. There's lots of different innovative ways that we could reach young people.
Brilliant. Just for full disclosure, I've just spent the afternoon at Dr. Mukherjee's clinic talking about FASD with the expert, so it was on my mind. But I just feel like there's brilliant work being done behind the scenes, but I still think when we're putting it out there that the drinking needs to be put up there with the smoking, so it's out there, it still seems like it's behind the scenes. And also, completely agree with you, Scott, but I mean, I'm thinking whether we like it or not, like the increase in energy drinks in our older children and their vaping, I don't know if it does, but there's all these sweet things that are going, and I feel like we should be targeting teenagers as younger teenagers as well. But thank you.
Do you want to come back, Scott, or you?
What?
Oh, Eilish, sorry.
I was only going to further add that as part of the Family Hub Start for Life programme, we have also developed a Making Every Contact Count training that is child and young people's friendly. And as part of that, CYP MEC, that's a lot of acronyms, but I have said it, children and young people, Making Every Contact Count training, we've included the dangers around alcohol and pregnancy as part of that as well, and that will be being rolled out to all children's frontline staff as well. So it's certainly a message that we're driving. I wouldn't want you to think that it's one that we're hiding behind the scenes on. It is definitely a message we're driving.
I didn't mean to, but it was just that when you look through the strategies, when you do the offers, drinking's still not on there, but the smoking is. So it was, that's what I was saying, rather than like, you know, you're trying to hide it.
That's because Scott's more showy than I am, but I'll make sure it's there next time.
Thank you.
Okay, thank you. Liz.
Thanks, Jo. Yeah, I had just a couple of questions with regards to the A&E admissions. So on the overall data, we've got that breakdown with the wards, but I'm just wondering do you have that data when it comes to sort of each other areas? So like for asthma, for example, I appreciate you can't necessarily put everything in these slides, but do you have that data? Because I'm just wondering if it's something that we can look at with regards to linking it in with air quality. And doing that with wards could be helpful to see what impact air quality in Medway is having on childhood asthma. And then the other one with regards to sort of A&E attendance is with like sort of children community nursing, it's not a 24/7 service, unlike sort of adult nursing it is. I think, you know, if you've got a health condition as an adult, you can kind of call someone to come out any time of day, but with children, you can't. Is that a nationwide thing, or is that just within Medway and how we commission? Because I'm just wondering if the data because we're worse than, you know, in comparison to nationwide, is it because of how we commission that service? Because if a child with complex needs is under a community nursing team, but they need to see someone at 2 a.m, they will have to go to hospital. Now, they may not go to A&E because they may be directed straight to the ward, so I don't know whether that comes in the data, is affected by the data or not. So I just wonder if that's something we can look at.
Eilish. Sorry, David.
Did you want to pick up around the data, or do you want me to come straight in on that? So
okay, you go first.
So we do have a breakdown of the data for a range of attendance, so asthma, diabetes, epilepsy, and others for children and young people. Interestingly, there's a members' task group currently being conducted, which is around air quality, and we had a stakeholders day on Friday. And one of the key themes that we presented around was the impact of air quality on asthma. And the asthma nurse came and presented, and hopefully there'll be some clear recommendations, one of which, I don't want to preempt the findings of the group, but one of which might be around our communications around that and how we help families understand the impact of air quality on their long-term conditions. So it is something that we are looking into and are closely monitoring the links around. In terms of the community nursing, it's not a service that we commission, so it's a service that's commissioned by the ICB, and so I'm not sure. I'm not sure that we know the comparison across the rest of the country on what's commissioned here compared to other parts of the country. In terms of that service, I can't comment.
Are you happy with that, Liz?
Could I come back? Yeah, sorry, I was looking at David throughout those questions because I just assumed that was going to be you. I mean, is that something we could look at? Because I'm just wondering if that is why the data is, you know, why we're performing so, you know, poorly compared to other areas. And just going back to the asthma one, obviously we're doing work with regards to the safer school streets, and that hopefully that will improve sort of air quality outside schools. But I'm just thinking about like a bugbear of mine is cars idling, and it just really frustrates me, and whether it can be work with regards to, especially outside schools, signs and things that say please switch off your engines when you're not driving, just sitting. It's particularly worse when it's either very cold or very hot, because I think people use their air conditioning. But I will sometimes challenge people and say, please, can you turn off your engine? Because it's horrible. If we're encouraging children to walk to school, and to be healthier in that respect and not sort of be driving, but then you have got these other cars that are sitting there with their engines running, and then they walk past and breathing in all these fumes. So just if there could be some work sort of with, maybe schools promoting to parents, please don't sit with your cars running, or some sort of sign to say, sometimes people just need that. They don't realise they're doing it, just need that reminder.
Yeah,
thank you.
Yeah, you're absolutely right. I think it is especially in the winter or the summer when it's particularly hot or cold. So there is a whole air quality action plan that's in place. It's managed by the Environmental Protection Team, but it is a whole range of partners across the council that input into that and support around that. And one of the things as part of that has been anti-idling campaigns within schools. So it is absolutely something. It needs the engagement from the school side as well, and sometimes, as Scott was saying earlier, you're pushing on an open door, and sometimes it might be a bit more challenging, but that is definitely one of the areas that is being looked at as part of that, and certainly one that I know that we've been promoting through our teams going into schools as well from public health side. I can absolutely ask about the community children's nursing and that out of our service and how that operates in other parts of the country, and see what we can find out.
Liz, I think sometimes the children lobbying parents is much better. When I went to give the Healthy Food Award at Kingfisher School, they just had some laminated stuff on their gates that children had made, showing the pollution coming out of cars. And actually, it was quite effective. So I don't know if it's something Celia could put in the head teacher's newsletter, because schools will have health promotion champions or PSHE or whatever they're calling, whatever acronym is in vogue at the moment. Thank you, Leah.
Hi. So much of what I had has been covered by colleagues. I want to know about the Better Medway champions. Just how are we ensuring that these people, or the people that have signed up for it, don't stray into giving medical advice or taking people away from accessing medical advice? So just how are we walking that tightrope, I guess. And then on some of the healthy eating strategy and the food for life, I wondered if there was any scope for engaging local charities to do some of the healthy eating courses. I gave a DPI of being a trustee at the Sunlight. I know we'd be keen to, but I know there's lots across Medway that may want to do that and have the facilities and the teaching kitchens and things already set up. And then the fact that lots of my other questions were taken by colleagues leaves me lots of scope to talk about Sure Start's poor relation of Start for Life. So just need to find my bit. The main thing was I'm concerned about the funding cliff edge and what strategies do we have in place to make sure that we can still offer a decent service after 2025, because I think that support's essential, and so much of the rest of the public health reports rely on early years training and training parents in both health and education. So having something they can drop into is essential. And then the satellite, so having something that they can travel to easily. When I looked at what we offer in the satellite centres, some of them are offering one session a week, one session a fortnight, but it's not on your doorstep. You're not necessarily going to access it. And if you can't travel, like I looked at the Raynham one today for something unrelated to give someone advice, and there is literally one session on a Thursday, then everything else requires you to get to Wayfield, which if you can drive is not that far, but if you're on public transport, that's a trip into Chatham and then a trip all the way back out. So yeah, I definitely had something else on Start for Life, but I shall leave it there. Thank you.
Thank you. So in terms of the ABM champions, we make it really explicit in the training, and it is a pretty comprehensive training. So it's a 2-day training package that people sign up to, and then they have to complete at least 3 modules on a range of different subjects after that as well. And we're really explicit that we're not training people to be experts. We are training people to be able to have conversations and to be able to signpost appropriately. What we do, so we don't just train our champions and then leave it there. We have regular newsletters and networking events that champions come back into, and we do refreshers of training as part of that as well. Their commitment to us is to go forth and have those conversations. Our commitment to them is to keep them informed and updated and continue to provide those opportunities. In terms of the funding cliff edge, of course, that has always been a concern of ours right from the first time that this funding was announced. And I remember having very careful conversations at CADMT and CMT, corporate management team meetings, about actually, should we even go for this funding, because are we going to set up a expectation of services which then may be taken away further down the line? But on the balance, it was universally agreed that this was still an opportunity to be able to increase the investment in the infrastructure for our children and families. So right from the very beginning, we've been thinking very carefully about what happens beyond 2025 and what do we invest in that doesn't create a dependency that then we won't be able to support beyond that. Some of the programs we have worked with our voluntary sector organizations on. So for example, Family Action had already received some national lottery funding to deliver perinatal mental health programs. They will continue beyond the life of this funding, but what we used the funding for was to give them the infrastructure to be able to train staff across Medway to better understand perinatal mental health, how it might be, how mothers might be presenting with that, and then how to signpost. So the sustainability of that is that we've trained up a workforce to be more acutely aware of that and understand how to signpost. Similarly, we have invested in the home learning environment to be able to do some early identification around Start for Life, again with voluntary sector organisation, and they are currently looking again for charitable funding to be able to deliver that beyond the life of the programme. So some of these things we've seen as seed funding to be able to support that, get it as a viable programme, and then that gives them the chance to be able to demonstrate that it is effective and be able to attract funding into those programmes. A significant proportion of what we've invested in is around training. So I talked about the MEC programme for children and young people. I've talked about the perinatal mental health training, but also our training that we've done, for example, with Family Hub staff around delivering the Singing Mamas programs. So those are things that they'll be able to continue to deliver beyond the life of the funding. We have sort of risk assessed all of the investment that we've done so far to try and understand what the impact will be if that funding doesn't continue beyond March 2025. And except for 1 or 2 programs, we feel that we've delivered them in a sustainable way that will still ensure that they're deliverable beyond the life. And of course, the capital of investment into the hubs, those sensory rooms, those sensory spaces, and other more accessible buildings will be continued. There's also things that have happened as a result of the sort of investment. So for example, the SEND teams within Celia's area moving into the hubs now, and that being a more accessible offer for families to get advice around SEND needs because those spaces are more viable now. And that will obviously continue beyond the life of the funding. In terms of the satellites, that is absolutely one of the things that we're trying to improve now through the various programs that we have commissioned. It has taken longer than we might have liked because we focused on the 4 hubs to begin with to ensure that those spaces were fully occupied, and we are now looking to those satellite venues to see how they can be managed better. It is slightly more challenging because they do sit within sometimes schools and other venues. They don't have necessarily receptionists available, so for people to come and go from them can be challenging, but it is something that we're looking at the moment to try and see how we can improve it.
So I think this might go more towards children's services, but along the Start for Life hubs and things, do we feel that we are capturing the families in need, those families that might just, they don't necessarily need full social service intervention, but Sure Start would have caught them and signposted them through that universal drop-in kind of model. And I'm wondering, are we still capturing those families and offering them that softer support? Just whilst we're on, that's why I stopped Scott, because I thought if we start talking about the Food for Life, we might as well do the hubs at once.
So yes, I think we are, but I could call Nikki to the table. So Nikki's just sitting in the audience there as the Family Solutions Manager who oversees the hubs. I think if Nikki's happy to come up to the table and answer that further, but I would say that the Start for Life Family Hub offer has enabled us to make the family hubs a more generic offer and therefore more attractive for families to come into. So it's not just seen as a social care hub, but it's actually seen as a place where you can go to access Singing Mamas or perinatal mental health support group or universal parenting intervention. And therefore, families are coming into them more than they were before. And I think Nikki would probably, Sasha. I think what we are seeing is the numbers increasing in terms of families accessing those services. But Sasha.
Thank you. Just to assure you really that absolutely it's all families that we're hoping to engage as far and as wide as we possibly can. And there are certainly many activities occurring both within the hubs and in communities. I know each of the hubs had, like for example, summer activity days, which was open to absolutely anybody in the community. As well as that, we've also got early help coordinators, and they work really closely with the schools in terms of identifying those families who might need that support earlier, way before the Family Solutions, way before those groups, way before social care, but actually really those emerging needs, their families are there, and the early help coordinators can go in, support the schools, support the staff about how do you engage those families in improving the outcomes for their children. So there is, I don't know if I've missed anything, I'm probably missed loads of stuff, but given my 3 months in post, I'm very impressed with the offer to really support and engage families as wide as possible across Medway.
Thank you. I'm conscious I sprung this as well because this was public health, and it's always in my mind that I just wondered how we are now doing that with the model having changed. Thank you.
Okay, thank you.
Just to answer the question about food and cookery. So yeah, we as if by magic, the slide has changed at the top actually. So around our training offer, so top of the pile there, not because it's in any particular order, unless probably asked me to order it, but eating well's at the top. So please don't misinterpret our training offer here as just being for Better Medway champions. We deliver lots of training, and we'll train anybody who's willing to kind of sit and listen to us for a couple of hours. Most of our master classes deliver over a couple of hours. So we would deliver training on Eat Well guys and the basics, from having the conversations about obesity to lots of physical activity awareness. We've got counsellors in the room that are very early adopters of the training, and we're really keen to deliver that training wherever people are. So if you are part of a voluntary sector group, a charity, a business, we'd happily go out and train groups of people on a whole range of subsets. So it's not just those aspects. In terms of actual cookery programs, again, we've got our diverse offer on the Better Med website around little chefs, little food explorers, and again, we generally take our cooking services to wherever people would like us to come to. We need certain facilities for some of our cooking activities. Obviously, we need the space for it to be safe for the participants, but yeah, if people have a group of people that would like us to come and do some training, get in touch, and our Workforce Development team would definitely provide something.
Sorry, I don't know if I missed this because I could have... But Leah's question about making sure that champions are champions and not expert advisors or blockers to maybe important healthcare.
Yes, thank you. So I did say that the is a fairly comprehensive training program in place for our champions, and part of that is about ensuring that they understand that this doesn't make them health experts. It enables them to be able to have those healthy conversations and be able to signpost appropriately to services. And we don't just do a one and done. We do the 2-day training. They then can complete, well, they're required to complete at least 3 modules, but can do more than that on a range of different subjects. But then we continue to keep them updated with a range of newsletters and bring them back for network events as well, where we update that training as well. So we ensure that the message is quite clear, that it is about signposting and healthy conversation rather than a medical model.
Thank you for that. And do they wear not a label, but like a badge to say that they're not, you know, like my sister's a psychiatric nurse, she took 4 years at uni. My other sister's a dentist, which was 6 years at uni. How does Joe Bloggs distinguish between that, please?
Because they don't sort of run clinics. The idea isn't that they run clinics or they invite people into services. It's not that. It is literally about imparting knowledge on people so that if they're standing next to Scott in the line and he's complaining about the fact that, you know, he feels he should exercise more, because we know that's always an issue for Scott, they're able to say, oh, do you know about this walking group that's free and available to you? It's not about imparting knowledge around health. It's about understanding the services that are available, understanding health inequalities, and then being able to have those conversations so that we've got community champions who can signpost to the Better Medway services, not to medical services.
Thank you for that. Adrian, you're next.
Thank you, Joe. And first of all, perhaps I could give a little plug for the Health Champions, because I had the privilege of being on the first cohort that went through, and it was very useful indeed. It gave one a much better understanding of public health, and yes, it does give you the confidence to be able to come back to people when you meet with them and they talk about various issues, and it is about signposting and knowing that what is available here in Medway, which is quite vast, is very helpful. In some respects, if you look at talk about childhood obesity, if we look at figure 2 on page 60, if you draw a trend line through the points there, it's very disappointing to see that it's still firmly upwards. And I know over the last 10 years or so, when I've been on the council, there's been a huge amount of good work done in this area, really strong effort. Because we were one of the first authorities to try and discourage fast food takeaways operating near schools when children were around, something that was adopted up in London much later we do. But when you look at that curve, it's still firmly upwards. The only sort of consolation up when I saw it, I was giving myself was, well, what would that trend line been if we hadn't have made those efforts? It would have been much, much worse. From my experience, most of our methodology has been firmly nudges, hasn't it? Gentle nudges. I'd just like to ask the professional officers: is it time, given the the huge cost to a society that obesity is going to make with extra costs on the health service, that we moved away from nudge more to shove, or would that be counterproductive?
I think that you're right. The trend line is quite daunting and quite concerning. So if you plot the adult one, we don't see the big dip in COVID, but this rise. Again, that's still creeping upwards. The trend line that does gives me hope is the one around smoking. So if you look at the smoking one over a longer period of time, from the 80s, backwards, it does show that it is possible to have a population level difference and get a behaviour massively changed. The smoking prevalence in the 80s was huge. It was a normal thing to see, wasn't it? We're now down to 12% of smokers as of the data published yesterday. So only 1 in 8 people. That's come down considerably. So if you then take a step back and think, well, how did we achieve that? The smoking prevalence is a result of taxation, legislation, local support. it is not a single thing, and it certainly isn't a local thing. So price does influence behaviour. That is the reality. So if there is two food choices, they're equally the same, and one's cheaper, you're going to go for the cheaper choices, and by default there is this. There's lots of conversations happening at a national level around over-incentivising the healthy behaviours and providing kind of financial burdens on the unhealthy behaviours. There is obviously lots of conversation around restricting advertising for children and families and seeing it. Eyeline is definitely byline. Advertising works, otherwise it wouldn't be a multi-trillion-dollar industry. So yeah, I think we probably will get to the point whereby the government did state an ambition around halving child obesity a number of years ago. Now, we use a dynamic system modelling approach, which is a very clever bit of science, which basically says we need to influence this amount of change, this amount of factors in order to halve child obesity. In order to get towards halving child obesity, it was almost impossible without some pretty significant kind of steps. So if you look at our target's about being better than average. But if average is still 40% of children being overweight or obese before they leave primary school, then me personally, my personal officer view is that we need to do more for our children, because that's just only going to lead to a whole host of health and well-being issues in the future that we're just stocking up. So I'd love to see more ambition and love more things. It would certainly help us go into schools if we have more national policy stuff when it re-incentivises and shows this is a key factor, but that's a very political thing and much beyond me.
Thanks, Scott. Yeah.
Thank you. And finally, Damola.
Thank you, Chair. Just the one question from me on emergency admissions for diabetes. So how are we raising awareness on how to avoid diabetes in under 19s? Because it seems to be going upwards. So I'm just wondering how are we raising awareness with that group, especially the 10 to 18-year-olds?
So, I'm just trying to find the slide, but I can't find it. Okay. Right.
So, do you want me to? Yeah, so again, this is a priority area across the Health and Care Partnership, and also as part of the national NHS framework to try and address health inequalities in children. Diabetes is one of the clinical conditions. So there is a range of things, but one of the most powerful things that has recently, in the last 12 months, been signed off by the ICB is the, I'm not going to be able to remember the name of it, but it's the glucose monitoring device that children can wear now that monitors their insulin levels and delivers the insulin if the levels meet the criteria. It means that the child's diabetes can be better managed because it's not relying on them taking readings, waiting for symptoms, and being able to inject themselves, which they may not be comfortable with. But it's a direct monitoring system that the child wears and delivers the insulin if it's required. And we anticipate that having a fairly significant impact on those emergency admissions, because as more and more children take that offer up, and from the last figures I saw, over 50% of our children are already using that and will continue to drive and increase that. It means that their diabetes is much better managed on the whole and will prevent those emergency admissions.
Sorry, just a quick follow-up. I'm sort of more focused on intervening a bit earlier before they even get diagnosed with diabetes. How are you kind of raising awareness? I don't know if that's with the parents, because maybe they're younger, but before getting to a level where you need to start tracking their glucose levels and things like that.
So the majority of children, it'll be diabetes type 1, not diabetes type 2. So it's not necessarily linked to obesity. It's more an acute condition, and then it is just about how it gets identified within the child, rather than necessarily a preventative thing that we can do. As people get older, it's more likely to be type 2, but the majority of our children, it's type 1 diabetes.
Thank you. Can I just come back on one or two things, if that's okay? Inequalities of health. I mean, obviously, my ward is one of the most deprived in Luton. And when you look at the statistics, whether you're looking at Bernardo's or our local statistics, the inequalities in health can take up to a decade of your life. Then that impacts children as far as I'm concerned, because they're often in caring roles, they're often living in poverty because maybe medicines are expensive, or they can't get to the most expensive supermarket because they're caring and looking after a disabled parent or relative. And therefore, food at a local shop is much more expensive than at a supermarket. What are we doing for our young carers in terms of, promoting them to have access to other things? Because if you're caring, you're actually probably not going to be using the youth service, you're not going to be using the gym, because actually you're looking after somebody, at a young age usually, aren't you? And then obviously, once the 10 years, or their illness is up, and, they're in God's waiting room, or they go to heaven or whatever, how do we promote that loss of what they've, in terms of bereavement and also making healthy choices themselves?
Well, I mean, Scott and I might do a double act on this, because we work very closely with Carers First as an organisation. So in terms of inequalities, there is a working group across Medway and Swale called the Core 20+5, which doesn't really mean anything in itself, but it is looking at the main inequalities faced by children, particularly in terms of health, and Carers First are a core member as part of that. And that's beneficial in two ways. One, it helps them to understand the broad range of services that are available and be able to link carers into it. But also, they have shared with us the challenges that are experienced by carers, so that we can tailor programs more to their needs. Explicitly, I can't name a program that we deliver that's specifically targeted toward carers. It's more about how we work with Carers First to be able to raise awareness and be able to support those carers through that organisation. Unless there's anything else that you want to add.
No, just to say, Carers First are part of our Better Together consortium as well. So we commission a number of, the council. So our partnership commissioning colleagues commission Medway Voluntary Action, Carers First, Kent Association of the Blind, and Health Watch. So they kind of come together, and we meet them regularly. We were talking about health inequality to them last Monday, actually, Amy and our team. So yeah, they're very conscious of that, and reaching young carers is a real challenge, isn't it? Let's be honest. It's a real, we'd love to get to 100% of young carers knowing the support is there. This is how you can access the healthy eating bit. Whether that's achievable in my professional career, we don't know. But just looking at Carers First Medway's website now, we've got our young adults carers chill and chat session happening on Friday, the 14th. So Carers First are really good. They come to our directorate day and gave a presentation, so all of our team know about them and we know about and what they're doing. So we often refer them because, they're the commission body, so we really want to make sure, bare minimum, every carer knows they can go to them and get some support. And then once they're in those doors, they're very good at then going, oh, good, we got some better Medway training, or we got this health walk and this is how to engage. So I think joining those two dots up is the most important part of that.
Thank you. And it's also, when you're isolated and caring, it's about your social and emotional well-being as well. So thank you for that. And finally, I know Paula touched on it, but, I do physio on the Maidstone Road where there are the grammar schools. And I really thought they were going on a school journey, but actually they were going to the kebab shop at lunchtime. And it was just, I felt really desperate for them because I could not believe they'd want to spend, it looked like the queue was going to be an hour's long. So are we doing, or can we have our champions doing some health promotion in schools? Because I just think there is the salt has got to be an addiction to fast food, isn't it? I mean, I know my weight fluctuates with the steroids that I'm on. So, you know, but young people just wanting to, and, you know, these are our top 5% of young people, you know, and I really did think it was a school journey or something for nothing, you know. Didn't realise it was the kebab and chip shop queue, which is really frightening. And then, you know, how do we combat that really?
I mean, it is really challenging. As a mother of a boy who's just started sixth form, who is very much enjoying his freedom to be able to go out at lunchtime, and your ability as a parent to try and, you know, dictate where he goes to get his lunch, it is very challenging. We have a really comprehensive PSHE program in Medway. I mean, I would, you know, be willing to stand up and say possibly the most comprehensive PSHE support program, because we have been developing it over a number of years, which gives a wide range of support around, you know, everything from healthy relationships to healthy eating, exercise. It's all about making informed choices, not just for our young people. So we need to make sure that they're armed with the knowledge to be able to make the right choices, you know, taking into consideration Scott's comment about price, etc., but that they're able to make those informed choices, but also that the parents are aware of the choices that their children are making and are able to have those conversations around that as well. So our PSHE program now is not just delivered across the schools, but we now have a full range of parenting workshops as well as part of that PSHE program, so that we know that the parents are getting the same messages to the children and that there can be those shared conversations around that at home. On top of that, as Scott was talking about earlier, there's a whole range of programs that go into school, whether that's the Soil Association with the Food Awards program, the Healthy Schools program, or Better Medway Healthy Schools program, which does an awards program, and even a lot of schools being part of that food partnership. There's a pretty comprehensive program that's in place, but as the conversations with Councillor Golvan, you know, it absolutely takes a village, and it is about those messages to our children and our parents at every opportunity within schools and without. And you know, there has also been some work through the planning application process to try and limit the availability. So there's pretty comprehensive work going on, but it's a battle that we continue to fight, I think.
And just to one really quick thing, ultimately, if we're talking about behaviour change and behaviour, the best behaviour change model and the best bit of science I've seen for the last 20 years working in the area is called the COM-B model, B being the behaviour. So effectively, if you have the capability, opportunity and motivation to go and get a kebab at lunchtime, there's a chance I'm going to do that. So how do we change behaviour? How do we change people's behaviour around recycling, around healthy eating, around substance use? You need to have the capability, opportunity and motivation to make a better choice. So if there is the capability, opportunity and motivation to make a healthy eating choice, I need to have the affordability for it. I need to have the opportunity to purchase it, and I need to want to do that. So none of the things we're going to be looking at over the next 10 years in our joint health and wellbeing strategy are easy. And that's why we have to work on environmental factors. We have to work on the motivation. We have to work on the campaigns. So, you know, it is a real important bit. And if you look at a behaviour thing like walking to school, how do we create the capability, opportunity and motivation for that behaviour? Because if you take one of those three out, it probably won't happen. So that's why there's never one silver bullet. And that's a really easy way of looking at behaviour change, although hard to do.
Thank you. Wayne.
Thank you, Joe. I just want to follow up from what you said about the kebab shops and then essentially following then what Alicia said. But I personally think, and as a parent of 2 children at school, first of all, the school catering, whilst they say it's really good, I think it's overpriced. I don't think it's overly nutritious either, to be quite fair. And so Alicia made the point about giving the children an informed choice. And they do have that informed choice. And I think what we should encourage, as this whole debate has been going on about encouraging a healthy option, a healthy style and a content to their meals. And on that point, in a kebab shop, for example, you can have a Greek gyros. Lovely, really healthy. If you wanted to go down that route, just
I wish they were having that, Wayne.
yeah,
They
I
were
know.
not.
Yeah, they're probably not. No, but they are the options there that people could have. But again, it's that informed choice. And yeah, I'm echoing your comment. They're probably going there for the greasiest, dirtiest kebab on the planet. But there we go. But so informed choices, and then I was going to touch on, and Scott's already made that point admirably, is we've got to also look at encouraging sports and making sport accessible to everyone. Now, I love the free gym equipments and everything else that we've got in some of our parks around Medway. I personally would love to see it in all, but obviously there's a huge cost in that. You know, ideally, it'd be wonderful to have. But what's stopping people going out on these walks and things like that? You know, walking is pretty much a nil cost. So we do need to encourage it, and it does actually start with the parents and the schools working collaboratively together on these kind of things.
Agreed. 100%.
Okay, well, thank you, Health. Really important, you know, for everybody to have good health, and the champions are helping us, but, you know, especially children. So over to the Vice Chair. We'll wrap this up now, please.
So I move that the committee notes both the Family Hubs and Start for Life programme and the Childhood Obesity 5-year plan.
Brilliant, thanks, Leah. And we've got the... Oh, sorry, we've got to second it.
Seconded.
Yep, seconded by Sharon. Lovely, thank you. Okay, we're a bit ahead of ourselves, but that's lovely, and it's lovely to welcome back Sandy. And you were here in good time, even though we're ahead of ourselves, so lovely to see you annually, and thank you for your comprehensive report, which you're going to run through.
Whoops. You might hear me better now. I do have a hearing loss, and I struggle sometimes to hear in an open environment. And Michelle will write down the questions if I don't hear, so that's the way we'll get around that. I'm not going to go into any lead-in for this report because I think it stands for itself, and there's nothing that I could say. I think the only thing is that you'll probably notice that the Children Act statutory complaints have fallen quite considerably, and that's because we are, alongside most other local authorities, only taking those complaints where they're about the needs of the child or the child's complaint, because that's what the legislation is about. But everyone has a right to complain. Well, not everyone, there's some who don't have that right. But that goes into the non-statutory process. And if we add the two figures up, the figures for the annual year, for this year, are about the same as they've been for the last few years. So just, I'm sure you would have noticed that discrepancy. So I'll open it up for questions.
Thank you, Sandy. Any questions? Leah? Adrian, then George.
So, firstly, I thought the compliment section was particularly nice. I thought all of them kind of had a running theme of how well our staff are engaging with both parents and children and running that and really treating people as humans beyond the cases. That was great. This wasn't specifically from the report, but I wondered if we could have some clarity around member involvement once a complaint is active, because often constituents submit a complaint, wait a couple of days and then contact either MPs or councillors, and then when we get in touch with the council we're told that we can't really be told anything because there's an active complaint. And that makes sense, but I wonder if that needs to be in some way communicated to people who have made that complaint sooner, because then when we go back, they're then frustrated because they would have engaged us before, if that makes sense. And then I had one other is specifically around when young people submit a complaint. I wondered how we deal with that. Do they get the response directly? Does it go to their foster carer? Just how is that? And then that's on the next report, so ignore. That's it. Thank you.
Okay. I'll start with the one you've just said, because I think that's the most important one. The complaints process is so that the child's voice can be heard, and we're very aware of that. Young people don't tend to do what adults do. They don't sit down and send off an email. They might complain to their social worker. They might have a little tantrum or whatever they want to do, but they don't follow complaints as much as the way adults do. So we have to take that in mind. We have to, by law, and we will always provide a young person with an advocate to help them make their complaint. They don't have to accept that service, but they can have an advocate. We will check with the young person if they want their parents to make a complaint, because sometimes they don't. And we wouldn't in our team, but we ask the social workers who have a relationship with them and to explain to them that it's their right to make a complaint. The independent reviewing officers for the children in care or on a child protection plan are very good at explaining about the complaints process to the young children. So I think we get their complaints, but not always as formal ones. But we will always check. And if I get a complaint, for instance, from a parent, and this was a young person about to leave care, and I asked him if he wanted them to make the complaint, and he said, not all of them, just this one issue. And when I answered to the young person, because although the mother had made the complaint on his behalf, it was his complaint. So we will all take their views into account. You could look at it both two ways. Our numbers of complaints from children are low, and that's a good thing, but also we're aware that we may need to make young people aware of the complaints process. And I think we do. I think everybody does. They just like to have a quick response. We have had, for the first time in a while, a stage 2 request from a care leaver. They usually just want a response and move on much more quickly than the adults do. Complaints themes.
That was compliments themes. The question was around clarity, how we deal when there's members involved in an active complaint. How do we... Apologies. Your question was around how we deal with complaints. Sorry, it won't stay on. Thank you. I think your question was around how we deal with complaints when a member complains on behalf of a constituent.
They are two completely separate processes, but we do try to join them up when a councillor or a member of parliament is involved in a complaint. We'll share the complaints with the member, but we have to get the complainant's consent. We usually ask the complainant to share their response themselves, because that's now their information, so they can share. But those two processes are different. They follow a definite process. There's a stage 1, stage 2, stage 3. So I don't know if that clarifies it, because I have had complainants come in with a councillor or member of parliament to be their advocate for them, but that's their role to speak for them, but not answer the complaint. So there's a difference there. So they are separate.
It's just made me think that I might just adjust my approach to those complaints, so that's fine. That's helpful. Thank you.
Adrian.
Thank you, Joe. Looking at the volume of complaints at 3.3, that is quite a dramatic fall in the volume of complaints. And I sometimes think that you need a sort of Goldilocks sort of KPI, because if you're too low, it makes you wonder, is it too difficult for people? Has something changed in the system? It's more difficult for people to get their complaints in and looked at? Or are we actually being absolutely brilliant over the last year or so? So it just seems to be going, from 3 figures down to low 2 figures. I feel a bit uncomfortable with that, because have we made things more difficult, or is this a genuine reduction?
I'll answer that, Councillor Golvin. If you look at the dates, you can see the improvement journey as it works through. So at Medway's Children's worse, I guess, really high number of complaints. As we've gone through that improvement journey, it has begun to reduce. I'm confident, but I'll let Sandy assure you.
Complaints are very accessible. People know how to complain. There's details on the website. They can phone us. They can write to us. They can email us. So, sorry. Right, can you hear now? So we make that as accessible as we can. We would get an interpreter or ensure that people with disabilities can make a complaint. We don't see them in the office anymore because that isn't really available. But if they really needed and were housebound, as we have 2 complainants, we would go to their homes to take their complaint. And make sure, for instance, if a young person's making a complaint, there's someone with them. It doesn't have to be a formal etiquette. Do they need help? So I'm convinced they know how to complain. But to go back to the point I made, if you add up the 18 there that we've got this year, that were complaints made either by children or because of the services given to the child, that's dropped. But the complaints from parents about how the social worker spoke to them or came unannounced or those kinds of complaints have stayed the same. So if you add it together, those 2 groups, because they were all together before and now we've separated them, they come to about the same amount.
Thank you. Thank you for that. I'm reassured.
George.
Thank you, Joe, and thank you, Sandy. It's good to see you as always. Thank you. My question is probably more for Leanne as the director. Just about how we're sort of embedding an approach around complaints. I think I'd be very interested to sort of know how the directorate management team sort of gets these complaints and then they feed into sort of wider service improvements. I think it's always important, even in complaints, and I know there's a number here that haven't been upheld, particularly the ones that have got to a stage where they've had to go to the Ombudsman. It's not sometimes always just, and it sort of comes back to something Leah was reflecting on, it's not just always the complaint itself, whether the person's right or wrong, but it's how that person feels. And I know, good complaints management is always about, a lot of people get, it's actually emotion more often than actually sometimes pure facts. I'm just interested in terms of how we embed some of the learnings from the complaints into the sort of wider service leadership, and then just also about how we sometimes reflect in terms of, particularly given that communication is very high as a reason for these complaints, just how we sort of feed that back into the work that teams are doing on the ground. Thank you.
complaints and how we handle complaints are very important to me, and probably any AD sitting along the bench will know that. I'm a bit of a stickler for making sure that complaints are handled within timescale. If somebody has a complaint, then I need to know about it. We need to handle it properly. Sometimes a family may find themselves coming into contact with children's social care, perhaps child protection, and that can be quite traumatic for families, and sometimes their response is to defend themselves, and making a complaint is something that everyone can do. Regardless of that, we need to go through a process, and we try as hard as we can to communicate in a professional, timely, open and honest way, but that might not satisfy that perception that you talk about. And of course, those families or that young person or whoever has the ability and the right to carry on through processes. And, you know, Sandy and Michelle will work very hard with those families to try and speak to them about a process, assure them that we're taking their complaint seriously, but that may not be enough. And that will come under the category of communication. As far as learning goes, the principal social worker for children's is very hot on this. There'll be sessions with social workers. The senior leadership team is always abreast of what not necessarily the individual complaints, but the themes coming out of complaints. Because you're absolutely right, that's how we learn. That feedback from our children and parents is a measure for us to be able to alter our practice. It may be the first warning signs that something isn't right. So we do take those complaints seriously. And with Sandy's help, Sandy will sometimes flag with me, I think there's something a bit amiss here, or maybe we need to focus on this theme. So I feel assured we've certainly got good internal communication, and I think the report, as well as the compliments, will show that, you know, we are doing quite well with our complaints and compliments.
No, thank you very much. Thank you, and thank you for all the work you're doing, and particularly to you, Sandy, as well. It's very important. Thank you.
And all, I think, you know, a lot of work is done by the teams, by the managers. If I need to meet with them, we would have what we call an alternate dispute resolution meeting, and the managers are always prepared to come. Or I can phone and say, hey, can you just have a chat with this before she puts in a formal complaint? Those managers now work really well with us, and we all work together to try and resolve the complaints for people, but also just to listen. I sat in a meeting last week where none of the complaint issues could be resolved the way the complainant wanted them resolved. But actually the fact that we just listened to the emotion behind it, I think that's a very important point, that if you ignore the emotionality in a complaint, you'll never get it resolved. But she appreciated that we just listened. And sometimes that's all it takes.
Well, that's just lovely to hear. Thank you very much, Sandy.
Thanks, George. Mark.
Thank you, Chair. Just a couple of points on bottom of page 70 and top of page 71. Said complaint types, lack of communication, out of the ones that were complained about, 100% of them are upheld at 6, which seems to me is just a little bit concerning, that we're not communicating and we're having upholding complaints. So we're obviously saying, yeah, that is correct. And it seems to, when you look on the top of page 71, that's increased, it's doubled in number in the last 2 years and upheld. Just a little concern also, so complaints upheld attitude of social worker. It says 3 on that chart, but on the other chart it said that none were upheld, so not 100% sure which data is correct. And just a final point on something that Sandy brought up with regards to the children and talking to them, which got down on 8.1. One of the points is for us to listen and take seriously what they say. You did mention when answering a question earlier that you asked a child if they're making a complaint, and I'm pretty sure that I looked after children are very much like my children, and one of the things is, I don't want to tittle-tattle because I don't want to be known as a grass, and children don't really want to raise that as a concern, but I just wondered, could you just put down that because we listen and take seriously what they say, even if they said, from what you've listened to and what they've said, and you go in, that's a concern, although they don't want to officially raise it as a complaint, would we still investigate that as though it was a complaint and through the same procedure? So just wanted a bit of clarification on that, please.
Well, if they don't want to make a complaint, we can't log it as a formal complaint. But yes, we send all referrals as referrals. If a child, they're unlikely to come to us initially unless they want to make a complaint. But they usually will talk to the IRO or to their teacher, people they have relationships with, or their social worker. And all those people would take that very seriously. Going through, phoning up, making a complaint with people you don't know might not be the style for a young person. What I do in all the training is make it very clear that equally if we get a concern that needs to be looked at, we refer to them, but the teams are now very good in referring back those concerns for us to make a decision how we handle it. And no, some of them won't go through the process because that's not the process the children are choosing to try and resolve their concerns. Some are lovely when they make a complaint. They really quite amuse me. I had one who didn't like the way the foster care had spoken to him, and he made a complaint. And then we had a meeting, the foster carer with mother, with him and the social worker and myself. And in the end, he was quite, well, I suppose I did deserve it because I hadn't been very nice and I was rude to her. So that was her, you know, she shouldn't, the foster carer shouldn't have said that, but the child recognised maybe he shouldn't have as well gotten to that argument. So that's how those sorts of things can be resolved. Yeah? Okay. About communication, that's a theme in many complaints. It's not just, it might sound we've upheld it, but the social worker might have been late for a meeting. She was late, we have to uphold it. But she might have been caught in traffic. So it's difficult to on a stats like that, explain it. But the sort of communication that we talk about and I talk about in training is explain procedures, explain what we're going to do. They don't know what a child protection conference is. They don't know what a child in care review is. Explain processes, put people at ease so they understand what's going to happen next. Explain the assessment process. Explain how we get consent. If you do that, it immediately reduces the anxiety and the need for complaints. I have a lovely compliment that came through of someone who said, the social worker came, she put me at ease, she told me what's going to happen next, she told me exactly what will happen in the assessment, she cared, she listened, and after she left, I felt so good because there was somebody who cared about me. So it's about that kind of communication. You can learn from a good practice in a compliment, but also understand how important it is. So it's not, I mean, if if the social worker's attitude had been serious, we wouldn't have taken it to complaint. It would have gone straight to staff conduct disciplinary process. So none of those complaints are serious ones enough to invoke any disciplinary procedures. I've only had one complaint that was immediate disciplinary and dismissal. So they are separate, but it's about how the social workers have behaved on that day and their attitude and how the person perceives their attitude and how they can learn from that. So it's not quite as serious as they're all upheld. It runs through all. At the moment, the Ombudsman's with adult social care said the most important theme that runs nationally is lack of communication about processes and understanding of our services.
Thank you for detailed response to that. Could I just ask going forward, because the comment you just made about they were stuck in traffic, one of my employees has just picked up 6 points while stuck in traffic. He just wanted to let somebody know. So I fully understand. And something like that, although it's upheld because they are late, if we can maybe highlight if there's particular ones where it's outside of their control. So
yeah,
traffic is outside of their control, and I would not say to condone to anyone, you must call. I'd rather get there late than to pull over, stop, come out of traffic, make that phone call, and then get back in and make myself even another late. But if we had that sort of thing, that would just show us that yes, it isn't upheld, but there's no way there is no way that anything has been done wrong by the person.
Yes, I think the Ombudsman has a much better system, and maybe we could start using that. You know, that is, there can be a fault, which is it's upheld, but actually it's caused no injustice.
Thank you. Sharon.
Thanks, Jo. This is just a quick one to Leanne, I think. The children in care, I've got I've got my dyslexic and menopause hat on at the moment. Is it the Momo app? Can they complain through that as well? I'm just thinking about children having access to complain. As Sandy said, sometimes whether they have got access.
What do you want me to? Yeah, me.
I think children can complain in any way they want. And if my view and my message to social workers is, if it sounds like a complaint, treat it like a complaint. So whether it's on an app, whether it's in one-to-one conversations, Sandy's right, young people don't always understand what a complaint is, but I will say to social workers, treat it like a complaint, because if it's not a complaint, then it can be just dealt with and you know, put to one side. The other thing is that when social workers go out, and Sandy said, you know, some of the best practices to sit with a family and explain. My advice there is also tell those families how they can complain. That's not always a practice I've seen during the course of my career, because of course once you do that, then chances are the complaints will go up. But that's not what Medway's about, it's not what we're about. If people want to complain in any way they want, through the app or face-to-face, then that's how we'll treat it.
Thanks. I just didn't know if there was a section on the app, because I haven't seen the app, to say if you're unhappy about... I just thought if there could be like if you're unhappy about something, and then Sandy's right, you know, most complaints, if you just listen to them, don't ever actually be a complaint. I just wondered if there was something on the app that the children could say, I'm not happy about this, and then we could intervene before it comes to a complaint. That's what I was
I'll double check and get back to you on that one, because I don't want to mislead you and I can't quite remember.
I think, Sharon, on the Mind of My Own, there is that opportunity, but social workers and individual school children at schools, the teacher in charge for the looked after children often gives you feedback, but also individual reviewing officers are really good at channeling the voice of the child or the young person as well. Sorry, that's just because I'm a foster carer, I'm just saying that. I've known all those routes work in the last decade and a half. Can I just say thank you, Sandy. It's always a pleasure to see you. I know I'm really rude, or I hope I'm not being really rude. I do think complaints are really important and they're tools for development, but I've never seen a 0 stage 1 complaint, which I've got from Children in Care Team 4. So I brought them some superhero chocolates that I hope you don't mind sending off to for Children in Care Team 4, because I do think there's very few human acts of kindness, but people are always ready to have a little rant. So the fact that there are 0 stage 1 complaints for that Team 4, I think deserves a superhero chocolate at least. So if that's okay. And the other thing is Leanne alluded to it, about us moving from inadequate and that being a barometer of improvement. And on page 75, with our young people, their complaints look at our journey on the road to improvement as well. And I think as we're the Children's Committee, we need to recognise that. And finally, did it put me in a happy place reading the compliments, Sandy. I'm not, I've got mobility issues, but I could have been the dancing queen. So thank you for all those compliments that were there for our hard-working people in social care. Okay, Vice Chair.
The Children and Young People's Overview and Scrutiny Committee is asked to note that the Complaints and Compliments Annual Report of the 1st of April 2023 to the 31st of March 2024. Seconded.
Is that seconded? Thank you, Mark. Okay, we're sailing along this evening. So, Sandy, you're welcome to stay, but I think it's, you can make a swift exit as well, because we're now on to item 7 of our agenda, which is children missing.
Thank you, Chair. So just very briefly, you've got the report. This is for the period of April 23 to March 24 regarding children that go missing from home and care, for which we work very closely towards statutory guidance for us. So Children's Services work very closely with our partners, our police, youth offending, etc., and in order to progress support for our children who go missing. Young people and children do go missing for several different reasons, of those which I'm sure the committee are aware of, for example, peer relationships, difficulties at school, family conflict, etc. Every young person that goes missing is offered a return home interview, and that should be conducted within 72 hours of them missing. In Medway, we are very on top of our missing children in terms of we have twice daily reports of the children who are missing, the period of time they've been missing for, and who within social care is responsible for those children. You'll see at table 8 the incidents, and what we are seeing is that actually, whilst the number of children have decreased only slightly, the number of missing incidents have increased. And this, for us, evidences a complexity around the needs of the children, meaning subsequently that they continue to go missing. We do have quite a cohort in Medway of children from other local authorities who do go missing whilst here in Medway. However, we also work closely with the police and other local authorities in order to try and minimise those missing periods. You'll see some data on table B and C and D, which I don't intend to go through, but you can see that's around the gender and the ages of the children that are going missing. So we undertook a number of return home interviews, and you can see on table H, we've talked about the duration of the absences of the missing. But what we need to remember is that return home interviews are actually with consent, and whilst we do our best to persuade parents and young people to engage with those interviews, it is ultimately their choice. So, looking over, we've seen that there has actually been, in terms of our achievements, some real progress in timeliness. So there's been a 17% increase in the number of return home interviews being completed in a timely way. I've talked about the reporting and how that's really improved and is now much more regular than it has been. But we've also been working hard on the quality of those return home interviews as well. Then coming to table 7, you'll see that where we are focusing on is the children that are actually placed outside of Medway and the challenge of undertaking return home interviews in relation to them. And then secondly, the quality of return home interviews. We're always working, as you would expect, in children's social care on the quality, particularly for those for our children in care, where most largely the social workers do them as opposed to our return home interviewers. That's the report.
Thank you. Wayne's got a question. Anybody else?
Thank you, Chair. Sasha, first of all, I found that a very good report, and the work that is being done, I think, is excellent. And really, I want to start off by saying that within the report, those people that actually allow the children the opportunity to discuss their issues, for me, are the unsung heroes. And I know you've given out a bag of heroes, but these guys deserve something as well, because it's been echoed and following what Sandy said about the complaints and letting people know, you know, the fact that they're giving the children that ear and that opportunity, I think, is commendable to the highest level. So please let that be known publicly that I think they're doing an excellent job. I may be completely daft here on this point, and I just require a bit more explanation, if you may. But within the report on page 87, just below table 7, you referred to the 7% increase. I'm just wondering, is there something that can be done to seek a reduction that you're not already doing to prevent these young people from running away or going missing, as the case may be? And secondly, it's then noted that 98 children went missing whilst in Medway's care. And then there are 146 that then went missing that are the responsibility of other local authorities. And I don't want to make it all financial because it's more important than the finances. But the amount of money that we must be spending on trying to locate these people, is there a compensation almost from the other local authorities when they go missing? I couldn't see that in the report, and I'm just asking really for my own personal knowledge. So, as I say, thank you, that's all I've got on that point.
Thank you. There's actually a huge amount of work ongoing with children and young people and their carers, foster carers, etc., residential units, in terms of trying to prevent those missing incidents. But equally, it's around the complexity of exploitation of children, because very often there are adults actually behind that. So it's a much wider picture and takes that multi-agency approach.
So is that like the county line?
Absolutely, that's exactly what it is. So it's very important to engage, for example, partners like police in terms of disruption of those adults, for example, who are perhaps, you know, encouraging that missing from home and encouraging our young people, for example, to deal with drugs, etc. So that is a challenge. However, there is a great deal of work going on, and particularly around the return home interviews, and it's great to hear you talk about those people that undertake them, because often they can hear some really harrowing details about those children's lives. So thank you for that, and I will pass that forward. The other local authorities is a challenge for Medway because there are a number of children placed here. And I know that we work very hard in trying, both ourselves and the police, in engaging those other local authorities because it's their responsibility to undertake those return home interviews. So of course we ask for copies of that. We want to know, if they've got a contextual safeguarding panel, for example. Have those children been heard there? Have they got a robust plan around that? And, that's equally important in terms of what do they expect the police to do in relation to that when them young people are reported missing. So yes, we do try very hard in relation to those children because even though they're not our children and we're not responsible for them, they're still in our area and spending time with our children, might be in our schools, for example, so they are equally as important.
Mara.
And in terms of the funding, I'm certainly not aware of any interagency local authority funding going back and forth because also you must remember if we charge other local authorities for locating their missing children, they could also then turn around and charge us. So it's kind of seen as really not worthwhile, yeah.
Thank you. Keith.
Thank you. We know that in a lot of sections of society, people with learning disabilities are quite high up. There's a greater percentage of people with learning disabilities in the prison system, for example. One of the things that I didn't notice in the report was what percentage of those that have gone missing have got a learning disability. And I wondered if there was a way of picking that up or not.
Sorry, I didn't hear just the last bit of that question.
I just wondered whether there was a way of picking up percentage-wise people with learning disabilities that have gone missing.
Thank you. I'm just trying to think how we could potentially do that because you're absolutely right, it is an area that's missing in that report. I think we would have to think about that because whilst you were talking, one of the other things we haven't included in the report actually is those children who have got EHCPs. So that would certainly be a starter for us in terms of indicating the vulnerability. So we'll certainly take that forward for the next report. Thank you.
Thank you. Leah.
So I had a few. One was around the return home interviews and the amount of time it takes. I wondered if the ones for Medway children who are placed out of area, I wondered if they are done on Teams or if they could be done on Teams because a lot of the issues seem to be around getting there to do that. So what's that one? And page 89 with the ethnicity makeup. It didn't really say in there how well that lines up with the demographic makeup of the overall cohort. So is that does that look the same? And then I was typing this as you called me. So on the funding thing, I sometimes think of our propensity to London and therefore us having cheaper housing from them. And this isn't just on children's, it's out of area housing and everything else. I think we actually probably spend more considerably than we make in that kind of reciprocal relationship. I think it's costing us a lot more. There's probably a wider conversation to be had about that.
You can potentially be right, but actually you'd have to factor in the admin time, the VAT that's associated on top of that. And it's not just with London, we do go across Kent as well because we actually place some of our foster families and our IFAs into Kent. So if any of those go missing, they're across the borders and it's a really big industry for not a lot of benefit.
James.
If I could just come in on the ethnicity element, just looking at that, I don't know in line with the particular children in care, but it is within a percentage and a half of what the ethnicity mix is in Medway overall. So if that gives you some idea, but we could probably break it down specifically to that group, but broadly it's within a percentage or two of Medway's population.
Adrian.
Thanks, Joe. It's a well-known fact that some criminal gangs, particularly involved in the county lines, that do home in on disadvantaged children and particularly look for children in care. Is there any evidence that any of our, particularly our Medway children, have been drawn into those criminal gangs? Because the gangs can be very vicious and nasty. We know that there's at any one time around about 50 county lines going through Medway, so it's quite a significant problem. Is there much evidence that our children have been drawn into that or not?
I think it's very difficult to be absolute about that because of the nature of exploitation, really. And so I wouldn't want to give you a figure or an approximation around that because it's really hard to tell. I think what's happening is we need to become, which we are, more skilled in how we talk to children and young people in these circumstances because everything's becoming more sophisticated. So actually, exploiters are becoming more sophisticated. You know, social media is becoming more sophisticated. So it's really about focusing on our staff's skills in order to kind of extract that information. So I couldn't sit here and tell you absolutely because I suspect it's probably far more than even any of us would know or even think, unfortunately. Yes, absolutely.
Leah, do you want to come back? I think I cut you off. I'm so sorry.
I didn't want to come back, but I think, sorry, I can't read your name tag from here, but an answer on the return home interviews that are for out-of-area children.
Thank you. Yes, sorry, you suggested about teams. And I think you're absolutely right. We need to look at our technology and how we use that more effectively. But what happens with the return home interviewers is we try and maintain it as the same person so we can build that relationship and that kind of trust. So I would be expecting people at least the first few times, if they are a repeat missing person, to be building those relationships, and potentially some point in the future that might go online or if circumstances allowed that, but it doesn't quite fit the ethos in terms of building them strong relationships to do that via Teams.
Okay, thank you. Can I just make sure I've got everybody down, because you know I'm blind in this eye. I've got Smither next, Douglas, Mark and Paula. Have I missed anybody? Great, Smither then.
Thank you. I'm just trying to formulate what to say. I actually found this quite upsetting to read. I've got a 15-year-old and a 10-year-old, and I can't, like, I'm picturing them in this statistic. It's pretty upsetting, really. Can I just ask some very basic questions, just to understand this clearly? Should I assume that all the children in these numbers have all been returned safely at some point or the other? And also, missing cases that don't end so well, that end in maybe fatalities and things like that, they're not reflected in these numbers, are they? And also, I mean, the whole children placed far away from their home and from other local authorities, I mean, the whole thing is broken. It's just appalling, really, to displace children like that. And I mean, you can't answer that. I realize it's a bigger problem. I'm just saying it's so wrong to do that to children. When children go missing repeatedly, I understand about gangs and criminal structures like that, but when children go repeatedly missing, what kind of support happens for the whole family, for the carers and the children? Just curious about that.
Thank you. So there is a hell of a lot of support around for families and for children who are repeat missing. So we would start at as you would expect, at that kind of very early help stage. So we would want schools to identify children potentially who are at risk of going missing quite early and getting support packages through our family solutions colleagues, for example, or from their team around within the schools to support them. You would then, if concerns increase, then of course we've got our social care support systems that can come into play. So you'd be talking about kind of CHIN plans, so the children in need plans, where you get very much a multi-agency group working together with the family in terms of how they can look at what the needs are within the family and support them. Because often children who are missing, it can be symptomatic of other matters and other issues, like I touched upon earlier, you know, challenges within the parental relationship, for example, domestic abuse, substance misuse. So it's really kind of looking at all of the problems around the families and working with them to try and minimise the factors that impact on those children missing from home. And then subsequently, of course, we've got our child protection processes. So if we really are so concerned about these children and their missing episodes, then we would look at making them subject to child protection plans. But equally, there is a lot of work strategically ongoing with our partners. You know, the police about looking about, for example, areas where our children are going. So when we're talking to our children, we are trying to find out, well, where are they spending that time? What do we need to do about that? And then we're talking to our community safety partners about, for example, well, have we got CCTV in that area? Do we potentially need to put CCTV in those areas? Does our child policing team, for example, need to focus in that area? So, you know, it's very much a collaborative whole agency approach to the challenges. So from the minute emerging problems up to them really kind of complex, contextual, that need that multi-agency response.
Hey,
about
Douglas?
my other questions about the...
Sorry.
I started with a couple of questions about understanding the data. I asked if I was right in assuming that all these children have returned, all the children in this?
Absolutely, that's my understanding.
Okay, and none of them have ended in any disaster or anything terrible for the children?
No. And just to assure you, I every day, every working day, get a missing children report, so I know the names. I know how long they've been missing. So there's a really, really robust structure around this, just to assure you.
Okay, is that okay, Smith? Sorry. Douglas.
Thank you very much for the report. It's one of these reports that really begs for the drill down. I think my colleagues on both sides have been trying to ask for more detail because it's so informative. And also we need to be thinking more about preventative measures, which the detail, if you drill down, could kind of like give us that indication. I was more concerned regarding children that have been held or detained or about to be detained under the Mental Health Act, because that data is not there. Like the section 136, you know, how many children are running away, preventing themselves being put on a section for, say, mental health issues. And I think that data would be very useful to track that with other services as well. Thank you.
I mean, just to reassure you, really, if we were that concerned about children and young people, then we would be actively searching for them in terms of we wouldn't allow them to be missing for any great length of time should they be at the point where we thought that they needed a hospital admission. That would be really serious. And we would take proactive action around that. Sure.
I've just worked with many young people that when they're about to be detained, they run away. Because the reasons why these young people have gone missing is that's where we're trying to find the detail as such. So I totally accept that's what you do. But in terms of, again, the multi-agency working, trying to put preventative steps in there, it would be interesting to know some of the origins of the reasons why they're running away.
Thank you. Mark?
Thank you, Chair. With the comment by my colleague with regards to a lot of data in there and reading through and scrutinising down, when you look at Table A, number of children drop in, RHH completed in 72 hours, 86%, missing incident 1974, that makes it look like it's some really good figures there, and you're getting a lot of information. But actually, when you drill down into a report, when you go to 4.13, that 86% is not 86% of 1,974. That 86% is of the 826 interviews conducted, which is only 63% of the total, because there's reasons where people can refuse. But that figure up the top, just looking at that, looks like 86% of 1,974 return home interviews were conducted within 3 hours. So which that isn't the actual data which you got it in the report. But if people would just start having a look at that, it looks completely different. Then regarding to people why they can refuse, I can understand the repeat missing children. If they've gone missing before you've had a chance to interview them, it's a bit hard. A refusal from the child, I can understand. And children care placed at a distance, I can understand. A little bit concerned about parent-carer refusal. Just like to, if a parent or carer is refusing and it's not the child, would we flag that as a potential concern? Because looking at potential coercive behaviour and something to hide, they don't all do that, but it sends a little bit of an alarm bell about parent-carer refusal. It might be only a small number, but hasn't got any figures on that. And also looking down at the numbers, at 457 children, 98 of them children looked after children, which proportionate of the amount of looked after children in Medway and even across the country, there's nearly 25% in that area. And as a number of us sit on the corporate parenting board, is a major concern. And I just wondered, is there any trends for, I know the looked after children have come with, I don't like to say, come with a lot more baggage than others. And we're supposed to be trying to make it better for them and get better outcomes for them. And is there anything else that can be done to especially help all the children, but also that 98?
We don't often leave with baggage. We usually leave with trauma, but we don't, not even a toothbrush sometimes.
Thank you. The data is complex. There's no doubt about that, and it is often quite difficult to get your head around. And I think that's partly because of the number of times the children go missing as well. And the return home interviews aren't always exactly to each event. So, for example, if a young person's going missing, say, 3 times in a week, it might not be that you then don't do a return. You do a return home interview, but it covers all 3 of those incidents. So it's not kind of all directly relatable. Hence, a bit of disparity between all of that. In relation to, I can't remember if it was your question or a question before, but you was talking about the origin and the reasons that children go missing. And I think we do quite a lot of work about themes and trends, and we call them like the push and pull factors. So, what pushes children and young people away from their place of where they're living, but actually what can pull them back in again. So I really take your point about that, and we'll include that in the next annual report in terms of what we're finding them push and pull factors are. Refusal numbers is again a challenging one, and I think we do try every way we can in order to ensure that young person knows that that's something we want to do and that's available to them, even if the parent does refuse. But we wouldn't just leave it at that. So, for example, we potentially would let the school know that that's what's happened, so that other people around that child is aware of what's going on and can potentially talk to them about what's happened for them as well. And you talked about some trends. The trends for looked after children. And again, that fits in with the push and pull factors. So we need to make sure that we're analysing what what those children are telling us and what those challenges are. Because, for example, when we look at children who are still with their families, it's very often conflict within that parental relationship. So what is it for those children who we're actually looking after? We really need to consider that. And I'm just thinking off the top of my head now, and one of them is sometimes that they're bored in their placement. That, you know, they feel that they aren't being potentially stimulated enough. But then, of course, the return home interviewer would feed that back to that placement, to our commissioning colleagues about, you know, what is that about? Why is that happening for that young person? And what do we need to do to mitigate that risk moving forward? Okay.
Thanks. Paula, then Sharon, please.
Okay, I've just, it's a little difficult to see with just 1 year's data, but I'm just wondering if there are seasonal peaks and troughs in terms of, yep, thank you. That was my first question. I suspected it, given the shape of the graph. The second one, obviously the majority of the children who have missing child incidents are male. But I'm just wondering to what extent, we've talked a little bit about child crime exploitation, but what factors or, you know, what aspect of child sexual exploitation lies within this, within the data that we can't see as well? That was another question. And then I think you've answered my question about how you're feeding it into schools and stuff so that the safeguarding leads are aware of it. Yep. And the final question is it possible, along with the EHCPs, is it possible also to pull out data around missing child incidents for those children who already have child protection plans in place? That's it.
So to that final one, absolutely, we can separate it off into that as well. Child sexual exploitation is actually really difficult to quantify. And, you know, what we might perceive as that, very often children in those young people, those circumstances don't actually see themselves as being sexually exploited as well. So that is very much within the subtleties in terms of the return home interviewers and their skills in order to try and extract that information. And what we often find is that exploitation isn't just about one area. It's not just criminal, it's not just sexual, and it's very much can be a mixture of the two.
Sharon?
Thank you. Thank you, you two. You just led me really nicely into my question, and I was going to do a bit like Wayne. This is just for my own bit of background knowledge. I fostered a known runner, and Smith has said, even though I was a foster carer, the first time she went, it was the most scariest thing. She then continued to run. She then got involved with a known paedophile, and we could go and get her, but this was about 15 years ago, and it wasn't a Medway child, but we were in Medway, and I was told that she was 13 years old, that child protection couldn't take her, so she was missing. I knew where she was, and I told them, but they couldn't go and get her because you rightly said she didn't know she was being so I just didn't know if that had changed. That was about 15 years ago. I mean, they did in the end, because another girl got involved and then made an allegation against him, but all the time she was complicit in it, at 13, they said that they couldn't go and get her.
Fortunately, a lot has changed since those days, and people would absolutely be going out, the police would be going out, social workers would go out and would be absolutely trying to remove children, if they were in those situations, from those situations, to assure you.
Brilliant, thank you.
Thank you, Sasha. I've just got a quick question, if I may. You fitted in, I know it's your first meeting, and you're new to Medway, but you fitted in really well, and you've got really robust and informative answers. My worry is when they're missing, they lose out friendships and education. Are we doing anything to plug that gap? The second thing I'd like to ask, and in your report you do explain, or I recognise the importance of prompt and consistent, and the importance of the the meetings and the consistency of person, because it's all about relationships. Have we ever considered in the hard to reach maybe using technology as our friend in terms of a QR code? Because being neurodiverse myself, if someone's ruffled my feathers, the last thing I'm going to want to do is talk about it, but I might pick up a bit of technology and have a little rant, not that, if you know what I mean. And I just wondered if we were harnessing that. And my final point is, do you feel we're doing everything humanly possible within the resources that we have to unpick the reasons and prevent the merry-go-round and the spiral of what missing can be, please?
So if I start with your last question, I think we're absolutely doing the best we've got in the resources that we have. There's absolutely no doubt about that. I think, do we need more resource? Absolutely. And I think, even a little bit of more resource would support us in looking at our children in care as well. So extending our current team to work with them, which is the point 2 in the risk. The risk, it's not a graph, is it? The risk table. So yes, we are doing absolutely. I think your idea of a QR code is a really good one. I haven't thought of that, so I'll take that forward if that's okay outside of here about how we can potentially use that. Perhaps the team could have that. Yeah. No, that's a great idea. And then in terms of losing friends and education, absolutely, and that's really what those team around these children is about, trying to maintain and support. And of course, education and schools are crucial in that. So in terms of those child in need meetings, those child protection meetings, etc., really trying to pull everything in and pull those children into those support services that they've already got and always had, and not allowing them to be pulled outside of there, what's attracting them, what's pulling them out, is it money, is it drugs, what is it, and trying to identify those reasons to support those continued relationships and education.
Thank you so much. Your expertise is phenomenal. Bless you. Have a lovely rest of evening. Vice Chair.
So I move that we note the report, and I didn't quite catch what the QR code was to introduce. Sorry.
I just wondered if we could bring, because I've been a runner myself, you wouldn't believe it, in the past, but that a QR code, would be useful if you were neurodiverse or had communication or maybe even sign language, maybe wanted to use technology as your friend rather than, have your missing meeting.
I see. Okay. So I move that we note the report and introduce a QR code to make missing meetings smoother.
Thank you.
Wayne?
Is that seconded? Thank you, Wayne. Okay, we're nearly there then. Thank you all. Fantastic questions from both sides this evening, and also our gorgeous trio at the back. So, the work programme, I need to confess that Stephanie has been helping Leah, Mark and I with Celia's support to chivvy in some outstanding areas that we've got. So we've already got that going on. So are there any other issues, Stephanie? No. So unless there's anything from the floor? Okay, meeting closed, and thank you all. What a team. Bless you. Good night.
you.